Our webinar today is titled Integrating Point of Care Testing in Community Pharmacy Practice, Findings from a Global Intelligence Report. Pharmacy professionals are fully committed to an interprofessional and patient-centered approach to healthcare, where the regulatory framework allows it. A wide range of point-of-care tests can be carried out in community pharmacies. They can be incorporated into disease management programs to monitor the effects of treatment in people living with non-communicable diseases. In addition, in acute situations, pharmacy professionals can use point-of-care tests to support clinical decision-making and provide rapid, safe pharmaceutical care. These tests provide valuable data to inform health-related decisions and reduce avoidable visits to primary care physicians or emergency departments. And I'm pleased to announce that at this event, FIP will be launching a global intelligence report on pharmacy-based point-of-care tests. But first, to introduce myself, I'm Sherif Guorgui. I'm a pharmacist from Canada, and I'm the FIP Community Pharmacy Section President. And joining me today is a fantastic group of colleagues who will be sharing their insights and experiences on the point-of-care tests, and they will also be answering any questions that you may be having later on. I will be introducing them very shortly, but I just wanted to take a quick moment to thank each one of them for taking the time to be with us today. And I personally cannot wait to hear from them and to learn from their experiences on how they effectively integrate point-of-care testing in community pharmacy practice. But first, we have some housekeeping announcements to cover. Please note that this event is being recorded and it is also live streamed on FIP YouTube channel. And the recording will be made available afterwards at events.fip.org. To everyone joining us live on Zoom, please feel free to send your questions through the Q&A box, and we will do our best to ensure that all of your questions are addressed. We also would like to hear from you. We're always interested to know how we can do things better. So please send us your feedback to webinars@fip.org. And of course, FIP is the global body representing over 4 million pharmacists and pharmaceutical scientists. So I would like to take this opportunity to encourage you to become a member of FIP if you're not already, and to learn more about the benefits of being a member and on how to become a member. Please go to FIP's website at fip.org. For today's agenda, after the introduction and housekeeping remarks, we will learn about selected findings from the FIP Intelligence Report on pharmacy-based point-of-care testing. That will be a recorded presentation by Ines Nunes Tacuna, FIP Practice Development and Transformation Projects Manager, and Infonobank ECPO FIP Remote Intern. Following the presentation, we will have a roundtable discussion and the Q&A with our subject matter experts. And these are the key learning objectives for this webinar. We will learn about the findings from the FIP global study on point-of-care testing. We'll learn about examples of countries with point-of-care testing services in community pharmacy, and on how pharmacists can be further involved in point-of-care testing services in their different jurisdictions, including the policy implications, facilitator and challenges, as well as some measured outcomes. As a quick background, in 2022, FIP Statement of Policy on the Role of Pharmacy Professionals in Point-of-Care Testing was published. This statement emphasized FIP's resolution to support government and policymakers, member organizations, pharmacy academic institutions, and individual pharmacy professionals who wish to promote the provision of point-of-care screening and testing services in pharmacies. And the report is being launched, today, builds on this mandate. A few key points to keep in mind. First is that the government and other stakeholders that support the implementation of pharmacy-based point-of-care testing will be able to expand the healthcare system capacity and offer more affordable and accessible primary healthcare to their communities. Investing in pharmacies and expanding the roles to facilitate point-of-care testing can improve patients' quality of life and result in significant healthcare cost savings for individuals and the government. It is also important to have point-of-care testing models that are flexible enough to continuously evolve with the changes in practice and technology. And the success of point-of-care testing in community pharmacy practice depends on leveraging resources, partnering with other healthcare professionals, and ultimately delivering personalized care and convenience to patients. There is evidence that demonstrates the potential clinical and economic impact of the provision of point-of-care testing by pharmacy professionals through early detection of disease, contribution to antimicrobial stewardship, and achieving health system efficiency. Today, we are pleased to launch the new FIP publication on pharmacy-based point-of-care testing, a global intelligence report. A lot of great work has gone into this report, and we will be listening shortly to the presentation from the authors on the key findings from the report. So with that, I would like to now introduce the authors. Ines Nunes-Tacuna is the FIP Practice Development and Transformation Projects Manager. Before joining FIP, Ines worked as a community pharmacist for more than 14 years and taught for 6 years at university as professor in the Integrated Master in Pharmaceutical Sciences in Portugal. She got a master's in pharmaceutical care and a PhD in pharmacy in the area of social pharmacy from the University of Granada, Spain. She is the author of several publications focusing on the area of pharmacy practice, especially related to patient-centered care. In FIP currently, she works mainly in the FIP Practice Transformation Program on non-communicable diseases. She is the lead and one of the authors of the pharmacy-based point-of-care testing, the Global Intelligence Report. And Mfonobong Ekpo is a young practicing pharmacist with more than 5 years of experience in the health sector. Her passion for health financing policy and management has earned her nominations to Nigeria's first country advocacy meeting on universal health coverage as a young people's representative. And the German West Africa Center for Global Health and Pandemic Preparedness Scholarship to attend a short course in health technology assessment at Ghana. She currently works as an independent community pharmacist in Nigeria and volunteers as a senior mentoring liaison officer with the Live Well initiative. She is a remote intern with FIP and the co-author of the pharmacy-based point-of-care testing, the Global Intelligence Report. So Ines and Mfono, with that, I will turn it over to you to play the presentation.
Hello, my name is Ines Nunes-Tacuna, and I am the FIP Practice Development and Transformation Project Manager.
Hello, my name is Mfonobong Ekpo, FIP remote intern and independent community pharmacist from Nigeria.
Today, we will be discussing an important development in pharmacy practice, point-of-care testing. FIP is presenting an intelligence report on this topic that gather inputs from FIP member organizations from around the world, to whom we are grateful. We are pleased to share the outcome with you. This report builds on the statement of policy on the role of pharmacy in point-of-care testing that the FIP Council adopted in 2022, and it aims to advance pharmacy practice worldwide and support FIP members in advocating an expanded scope of services by pharmacies.
The primary healthcare landscape is changing globally, in line with the objectives of the World Health Organization Declaration of Astana, with greater emphasis being placed on health literacy, disease prevention, and early detection. Pharmacists, as highly competent and accessible healthcare providers, are uniquely positioned to make a significant contribution to primary health care and preventive patient care. Point of care tests have been available in pharmacies worldwide for years. For instance, many pharmacies conduct blood pressure, blood glucose, and cholesterol measurements. Other points of care tests have more recently entered the community pharmacy setting, such as tests for Streptococcus A pharyngitis, influenza, SARS-CoV-2, hepatitis C, human immunodeficiency virus HIV infections, or celiac diseases. Clearly, the expansion and implementation of point-of-care test services by pharmacies in all regions will contribute to a more sustainable health system and contribute towards providing quality healthcare for all. To give you an overview of the methodology used in the report, it contains a literature review on the impact of pharmacy-based point-of-care testing, supplemented by a survey and a collection of case studies conducted with FIP member organizations to capture data and best practices from various countries and territories. Additionally, a group discussion with topic experts was also used to capture deeper insights on this topic.
According to the 70 peer-reviewed article included in the literature review, point-of-care testing for acute conditions or chronic diseases could benefit patients and society and represent an opportunity to expand pharmacy services in community pharmacies. Pharmacy-based point-of-care testing not only helps avoid unnecessary hospital or GP visits, but also promoted outpatient antimicrobial stewardship. This approach proved to be cost-effective when compared to physician-based care and resulted in an increase in quality of life for patients. Patient satisfaction with this care model was high, and it enhanced disease state and medication management programs with an emphasis on preventive care. Results highlighted the global variation in the adoption and practice of community pharmacy-based point-of-care testing services, with an increasing number of countries having implemented legislation to allow the provisions of such services by pharmacists and pharmacies. However, findings also show that pharmacy professionals can make little to no clinical decisions with the results of the tests they perform in several parts of the world, which is a major limitation. However, some interesting experience exists where point-of-care testing services have been linked to prescribing authority by pharmacists, contributing to reducing the pressure on general practice and emergency departments. Lack of adequate reimbursement and varying levels of national legislation to provide point-of-care testing services are the main recurring challenge to pharmacists' scope of practice. The 22 survey responses and additional 11 case studies collected from FIP member organizations form this point.
In our discussion with 11 FIP member organizations at the Insights Board discussion, we identified a few challenges. These included differences in legislation across states or regions, hesitancy from other healthcare professionals, and insufficient promotion of these services by pharmacists and associations. But it's not all challenges. A common evidence-based finding was that the COVID-19 pandemic significantly showed the indispensability of the sector and the willingness of community pharmacists to support patients even at a time of great uncertainty. It is possible to make use of this visibility to advocate for the use of pharmacies on the front lines of healthcare in point of care settings and in other capacities in order to ensure that these services are accessible, covered, and affordable.
The central message of this report is that the priority setting and implementation process of point-of-care testing in pharmacy across countries could be accelerated by engaging stakeholders in favorable policies, improving public awareness, engaging multidisciplinary collaborations, creating country-wide professional guidelines, protocols and frameworks, and advocating with data showing the benefits of these tests to patients, health systems, and economies alike. The report investigates and describes the role of community pharmacies in the provision of point-of-care testing for the screening and management of infection diseases and non-communicable diseases to support health-related decision-making and reduce unnecessary representation to general practitioners or emergency departments. The sustainability of these valuable services requires the establishment of appropriate reimbursement models for these tests, collaboration with organizations and governments, and advocacy using available data of the benefits of integrating community pharmacy point-of-care testing with healthcare schemes.
For point-of-care testing to reach its full potential and provide maximum benefits to patients, more work is needed by policymakers, educators, and researchers to ensure that such services are of high quality, patient-centered, and consistent. Pharmacists involved in these activities need to document and share best practices through publications so that their colleagues can readily adopt these best practices. Collaboration between pharmacists and other healthcare professionals is also crucial. Thank you for your attention. We hope you will enjoy reading the report.
If you would like to read the full report, please scan the QR codes on the screen. Thank you very much for your attention.
Thank you, Ines and Amphono for this Thank you, Ines and Amphono for this very informative presentation. I am sure we will be getting a lot of questions from the attendees later on about some of the points you have raised. I also would like to take this opportunity to acknowledge and thank all the FIP member organizations and individuals who contributed to this publication for their expert collaboration in this project by co-developing the survey questions and supporting the Insight Board conducted to collect detailed inputs from various member organizations as part of this project. In particular, the authors and editor, I would like to thank from the CPS, Mr. Jaime Acosta, the Secretary of the CPS, and Dr. Julien Fonsard, the Clinical Biology Section President from France. In addition, the survey questionnaire benefited from the Insights and Experts Review by FIP Vice President Mr. Lars-Åke Söderlund from Sweden, by the Chair of the FIP Board of Pharmaceutical Practice, Mr. Derek Conley from Ireland, and by the FIP Professional Secretary, Mr. Luis Lourenço from Portugal. FIP also thanks Ms. Emilia Ines Andre, FIP intern and pharmacy candidate at the University of Health Science and Pharmacy in St. Louis, USA, and of course, all the respondents to the survey and case studies as they provided valuable insights from their countries and jurisdictions that support the advancement of pharmacy practice. So now it is my pleasure to introduce to you our panel of all-stars. We'll start with Paul Sinclair, FIP President from Australia, Luis Lorenzo, FIP Professional Secretary from Portugal, Sarah Faisal, Canadian Pharmacists Association from Canada, and Emma Polino, Portuguese National Association of Pharmacies, and Mariette Eckstein, from the Pharmaceutical Society of South Africa, and Ellen Jones from the Royal Pharmaceutical Society in the UK. So welcome everyone, and we're certainly looking forward to a great discussion. So now also just would like to remind everyone, if you do have questions, to please send it in the Q&A box, and we will get to your questions. So with that, I guess maybe we can start the conversation. And I think one of the main points that we would like to talk about is that when we talk about point-of-care testing, what is the ultimate health outcomes that you think can be improved through the implementation of point-of-care testing? Everything we do in pharmacy is obviously with the patient in mind. So why do we talk about point-of-care testing? Why it is important? What health outcomes we would want to improve and achieve? So I'm going to put it out there and see which one of you would like to first tackle that one. Ellen, yeah, please go ahead.
Thank you, and thank you to FIP for the invitation to be here. There are so many health outcomes that can be improved with point-of-care testing, but I'd like to start by highlighting the focus on quite a wide aspect, really, but a very important one, which is antimicrobial stewardship. And when we look at the sore throat test and treat service that we have here in Wales, which is a national programme, it illustrates several ways in which the implementation of point-of-care testing has contributed to better antibiotic stewardship. So targeted antibiotic prescribing is the first one. The service employs clinical scoring systems, such as fever pain and CENTO, to stratify patients based on their likelihood of having an infection. And patients with higher clinical scores are more likely to receive a positive result from the point-of-care test. This targeted approach ensures that antibiotics are prescribed to those who are more likely to benefit from them and reduces unnecessary antibiotic use in patients with viral infections. And the fact that you get the test results immediately also ensures that patients can get the treatment that they need straight away. As a part of the service, pharmacists also help with the wider education of antibiotic use and ensure patients know to complete the course, for example, even when they are starting to feel better. And we have seen real changes in the way antibiotics are being prescribed through the use of point-of-care testing, and only 1 in 5 people who actually are getting a consultation end up having antimicrobials, but they also, those that don't need them, get excellent advice from their pharmacist and the pharmacy team. So, you know, in summary, the fact that we've been able to introduce that point-of-care testing has demonstrated better antibiotic stewardship and more targeted prescribing for us here in Wales. And these practices align with the principles of responsible antibiotic use and contribute to the global efforts to combat antimicrobial resistance.
Thanks, Alan. Certainly very impressive and very valuable too. So how is the government looking at the results of this, whether in terms of value, either also from a healthcare system capacity, or also from even compensation from pharmacy perspective?
One of the really important things for us in Wales in introducing the service has been to learn from the pilots. So they started with smaller numbers in certain community pharmacies, and we've been able to use that data working with the pharmacists and the pharmacy teams in those areas, and the patient results as well. How are the patients finding the experience and learning from that in how we adopt it? And because of the positive results, we have been very fortunate with the work that we have done with Welsh Government, that it has now become a national approach to this service, and it makes it a lot easier for us to be able to tell patients that they can access this service right across Wales rather than just in certain areas.
Absolutely. Sherif, I see you're next.
Thank you, Sherif. Thank you, FIP, for inviting us. It's a really near and dear topic to me as a community pharmacist. Elaine already talked about sore throat, and I just want to add on about increasing the accessibility to patients. So I think that's another important aspect that point of care testing provides. For very common conditions, a lot of people go see their GP, but we all know that there is a shortage of physicians. And it's very hard to get same day or the next day appointment in a lot of cases. So what happens is that people start going to the emergency room and hospitals. So I think point of care testing at community pharmacies allows that timely access for patients. And as Elaine talked about the antibiotic stewardship, I think that's really important because that reduces that unnecessary start of antibiotic. I also want to touch on, from the chronic disease point of view, that point of care testing can also be really beneficial because it can provide that more personalized and very timely adjustment of medication. So if we take an example of coagulation test, so if we are doing an INR monitoring that is being done at the site in form of POCT, I think we can not only reduce the adverse effect of a person's INR is higher and end up having a bleed episode, ended up going to the hospital, utilizing all the resources of our healthcare system, but also prevent from having a stroke if the value is too low. So I think that's the role over there for pharmacists is really important in disease progression and also prevention of increasing the burden to the healthcare systems.
Excellent. Thank you, Sherif. Marriott, I see you're next.
Thank you, Sherry, and good afternoon, good evening, good morning, colleagues. Thank you very much for joining us. Also, thank you for the opportunity to be here. So from my point, and I agree with what my previous two colleagues have shared, but when I think of point of care testing, there's really 3 points that's coming to mind. The first one is when you engage in point of care testing, especially at the early detection phase where it's situated well. For me, the purpose of point of care testing is to give someone decisions or options, because you may see signs of a progression that's coming, but at a point where you could still make changes to prevent that prognosis of going. And because you have the option of choices or decisions or possibilities that you can make, at the end for the patient, there is a quality of life that could be considered and could be enhanced, but also from a financial point of view for the patient or the payer or the government, there is a potential cost saving involved in the sense of you preventing a disease to develop to a full scale where maybe a lot of finances or expenses are involved. So in essence, for me, point of care testing is not something to be afraid of. It's really one of the most accessible tools that we have to manage diseases and to give patients options, but also the best possible quality of life.
Excellent. Thank you, Ariette, for that. When we talk about point of care testing, we typically look at it from an innovative approach, and we see that obviously there is innovation in the technology itself. So you can see even the point of care tests themselves keep evolving. But I think it's also important to look at innovation not just on the technology piece, but we also need innovation on the thinking piece from our stakeholders, our policymakers, government, in expanding the role of pharmacists and pharmacy professionals, depending on where the jurisdiction may be, to get them and allow them to do more with point of care tests. I mean, I think that's innovative thinking that we need to have. And also innovation itself from the pharmacy workforce themselves in moving beyond the traditional role and looking at doing more with their practice. So it's a bit of, I guess, a loaded question. Again, when you look at the technology and innovation piece on the product itself or the tool itself, the point of care test itself, the government buy-in to expand the role, and also on the pharmacy workforce themselves to buy in the new role and the shifting a bit from the dispensing piece to the services piece. So you don't have to tackle all of them at once, but maybe if there is one area of those that you feel that you would like to weigh in on, please go ahead. Luis?
Thank you, Sherif. And if I may, I just would like to congratulate the FIP team for developing this report. It has been an amazing job, and it looks really easy when you see the final result, but I'm sure there is a lot of work that is put on this publication. I would also like to thank, especially as FIP Professional Secretary, the work of CPS, the Community Pharmacy section, together with the Clinical Biologics section, because we had here a partnership between two sections of the Federation. So well done to all of you, and thank you for giving us this piece of information, which is very relevant from the policy point of view, but also from the practicing point of view. And if I may, based on your question, when you speak about innovation, of course, as we see the point of care, and probably most of the participants of this session and many other practitioners have been dealt with the data from these results. But we tend to think that point of care testing sometimes is very reactive in a way. We react to a request from our patient. But imagine that you have the first data regarding we have a certain value, for instance, for glucoses. And you might say, well, it is controlled, not controlled, that diabetes, or this patient might be diabetic. However, if you collect that information for instance, in 2 months' time or 3 months' time, according to a certain guideline that you set as a pharmacist, you can actually proactively ask for that same patient to come. Then suddenly you shift your practice, and then when you speak about the change of practice, pharmacists can actually have this role, this trying to keep this patient as your patient and try to keep on going throughout their life, or at least throughout some time, which I think is very relevant. And of course that you can do that manually, but we now have a brave new world of technology with the artificial intelligence. So why not use some data of point of testing as the starting point of something else, of a different practice of proactivity? And I think this is very relevant from the practice point of view. So when you speak about the government and the policy point of view, I think it's relevant to understand the whole landscape of data sharing, because we tend to think that we as community pharmacists sometimes do not have access to data, to patient data, which is actually which is the case, it's the reality. However, I think that sometimes we need to advocate that, hey, we need that data, but you also have data to share with all of you, with all healthcare professionals. Means that we have the point of care testing results. We are following up these patients, and suddenly we have two chunks of information that not get together. So I think from the government point of view or from the policy point of view, I think we should advocate for that. We are collating information. We want to share that information, and it's relevant to share as much information as possible, as robust. So actually both the practice and the policy part are really connected, because if you have more data from testing, you have more data to share with with our government, with our health system. So these two thoughts that I would like to share with all of you. Thank you.
Thank you, Luis. And I think you did tie them both thoughts very well together. And I think your point about advocating for government about the data piece is also very important. Like we typically advocate on the practice piece and what we bring in terms of value for that, which is I think is very clear, but also on the data piece, I think it's a good angle to tackle. So thank you for that tip. Paul?
Thank you, Sherif. And I would also add my congratulations to all involved in this report, its production, its collation, and will be a very valuable tool, I think, for member organisations, both for their members and also for the advocacy piece that will be generated by this report. Sherif, we talk about innovation and policymakers, but innovation can sometimes be a simple process, such as making the best use of available resources. And within community pharmacy, it has shown itself during the course of COVID to be in a lot of marketplaces an underutilised resource. Community pharmacy rose to the challenge of provision of COVID vaccines in many countries and helped enormously in achieving government goals in vaccination coverage. By the same measure, the capacity that resides within community pharmacy, particularly with respect to provision of point-of-care testing, provision of disease state management, is largely untapped. Point-of-care testing is a vehicle for community pharmacy to exercise that capacity in the most efficient way, because it's not the emergency department of the hospital that is providing the service. It's not a general practice environment, but rather the most accessible point of primary health care in most communities. So I think the policymakers have acknowledged pharmacy's capacity, and I think they are very mindful that pharmacy can do more and pharmacy should do more. And point of care testing, I think, in terms of innovation, the simple application of the capacity within the pharmacy, particularly the community pharmacy marketplace, is a big step forward. And in advocating for efficient use of limited health resources, the role of the pharmacist is coming more and more to the fore. So I think that point of care testing is just another very effective way to leverage both the accessibility and the capability of the pharmacist.
Absolutely. Paul, couldn't agree with you more. I think it's very clear since the pandemic that governments across the world have acknowledged that role that pharmacists play in expanding the capacity of the healthcare system. It is our responsibility, I believe, to continue to ensure that this message stays top of mind and to continue to capitalize on that. And I think, with the work that FIP does through such a report, is a good example of that, is how do we continuously keep the value of a pharmacist in expanding the capacity of the healthcare system top of mind, and we continue to showcase our value and build on the momentum of what happened through the pandemic. I think obviously the value of pharmacy has gone up extremely throughout the pandemic. And I think it's a good opportunity for us to not take it for granted, but to continue to drive it. I think we have everybody's attention at this time, from the governments to the public. A good example, and I know Sherif can certainly add more to that, but from a Canadian perspective, we've had point of care testing allowed to happen in Ontario, which was something that we've been advocating for quite some time. We've had minor ailments, which we've been advocating for close to 15 years in Ontario, and we've had it regulations passed in January 1st of this year, and just October, so just last month, they were even expanded even further. So I think it was just, again, an example of how the government is noticing, and an opportunity for us to continue to drive that. And certainly point of care testing is one of those areas that we can continue to push for. So thank you, Paul. Ellen?
Thank you, Sherif, and it's great to hear about the advancements from your perspective there. In a similar way for us in Wales, many of the services that the point of care testing are built into, we do actually have some connectivity with the technology between ourselves and GP practices to help make the most of that information. And when we undertake the testing, we are able to upload that information to share it with GP practices, which is really crucial to help with the wider healthcare for the individual. But as well as many of those advances in technology, and we're looking forward to more of that happening in Wales over the next few years. For me, the thing that really comes to mind when I'm thinking about the strategic implementation of services like this is collaboration. And it's that collaboration with other healthcare providers that really makes this work, from discussions with our members here in Wales, where they have built the services and informed the practices that are around them, working with GP practices often to decide which point of care testing would be useful in their neighbouring community pharmacies. That's where we really see that approach working very well. And the other collaboration, of course, that's truly important is with the patients themselves. And when the patients have really good experiences and understandings of the services that are available to them locally, we just see the amount of work that's going on in community pharmacy really increasing very quickly with regards to services like this that include point of care testing, and we have a number of common ailments schemes in Wales which would incorporate some point of care testing, but also we're very fortunate to have a prescribing service, a national prescribing service in Wales that is quickly progressing as we get more and more prescribing pharmacists working in community pharmacy.
Thank you, Ellen. It's always very refreshing to hear about that quick progression of scope based on the outcomes of what we've seen. We were able to achieve through the work we've done during the pandemic. So thank you all for that. Emma?
Hi everyone. And like my colleagues, I would like to thank FIP for doing this work and launching such an important report. And the work that has been done to support all the evidence that we have in the report is amazing. So thank you very much for that. And hi to everyone who is participating in the webinar. And hi to my colleagues in the panel as well. Well, I very much agree with Ellen. And just to say that from the experience also in Portugal, we've come from a situation where for a number of years we were providing point of care testing, but a little bit out of as an occasional service. So people would be asking for glycemia or blood pressure service in the pharmacy, but whilst we obviously provided the service and we counseled patients based on the result that was obtained, I do think that getting point of care testing as part of a larger service that includes a previous assessment and then has a follow-up on the effectiveness of the intervention, and where we see collaboration with the healthcare professional is much more effective and much more, and has a bigger impact in patients than just providing a point of care test as an occasional service by itself. So I think that it is important that we consider evolving in the point of care testing, not as a separate one-off service, but integrated into something, into a bigger service, into a bigger context that involves assessment, a context for the service that we are providing, for the point of care test that we use, and that the point of care test is an instrument in that service more than a service itself. I don't know if I'm able to convey my message, but point of care testing, I believe, is a great instrument to obtain factual information that we then can use in our interactions with the patient, to change behaviors, to assess medication effectiveness, to assess medication safety, and very often to be able to convey objective information to other healthcare professionals in order to support a recommendation from the pharmacists, for instance, to reevaluate the medication that the person is taking because the medication is not being effective. So point of care is an instrument for that, but I think that we are moving towards considering not point of care testing as a service in itself, but more of an instrument for larger context services. And I think that this report shows how to integrate the point of care testing into these wider scope services and how to use them to then influence other healthcare professionals' activities as well as the patient's behavior.
Thank you, Emma. I think this is an excellent point that you just made on how to look at point of care testing as being part of a broader patient service program rather than just a goal in itself as a one-off. Sarah?
Yeah, I just want to extend on what Emma was saying, and I kind of see it from the point of view of having a proper workflow in a community pharmacy to integrate these services. So yes, we are ready to do a lot of these services. We are very open that we will provide these services in the community. However, we also need to make sure that we have that proper things placed in our community environment. And like Emma said, if you're going to just offer a standalone point of care testing, there may not be as valuable seen by primary care provider like physicians or other healthcare provider or even the patients. But if you integrate that with one of your other activities that you're offering in your pharmacy, so for example, if you're conducting a medication assessment for your patient and point of care testing can be a part of that service, and then you can provide a proper care plan for your patient, I think that will enhance the utilization of the service as well as it will also improve patient acceptance. So I think that's really important. And then pharmacists can actually provide the service on a much larger scale as compared to just offering it as a standalone service. And if you integrate it in such a way, I think it would be also easier to advocate to the government, to the policymaker, to the payers that this is the effectiveness of integrating this service in a whole larger healthcare system.
Excellent. No, thank you, Sarah. I think there was a lot of great information and lessons learned from all the different jurisdictions here on this question. So thank you all for sharing that. I'm going to move up to now some of the questions in the chat box, and maybe Sarah, if you can still stick with us on that one. We'll start with you. So are there any learnings or strategies you can share on how you have advocated in seeking government reimbursement for point of care tests, which have been effective in other countries? This is currently a limiting factor in Canada due to the expensive cost of the point of care test products currently available, unlike other countries where the costs are very low. So maybe I guess, Sarah, we'll start with you and then we'll move to other members of the panel.
Really good question. And yes, I agree. In Canada, we have a very different landscape here. We have jurisdictions that are totally different. So from one province to another province, in a lot of our provinces, pharmacists are able to do a lot of different things, but then we don't have a very national scope of practice for pharmacists. So it is a problem where, unfortunately, point of care testing is not covered by provincial or private payers. However, we are doing some pilot studies in some of the provinces where we are actually involving that. And I hope that the results from those pilot studies will be a great way to advocate to the government about reimbursement processes. Strep throat is a very good example. We have seen the impact of COVID-19 testing all across the globe, I would say. So I think those are the examples, or those are the things that will improve the ideas around the proper reimbursement and payer models for POCT. So we are hoping that some of those pilot studies that are happening in Canada can be a start of advocacy towards the proper reimbursement processes for community pharmacists.
So thank you, Sarah, for that. Now, I guess maybe one of the things that I would want to ask here is, do we need a pilot just to show the value of the service? Like we can see clearly from a lot of data around the world, from what we've been hearing here in different jurisdictions, that in terms of the actual value itself, whether it's in the practice, I mean, Louis mentioned the data as well, expanding the capacity of the healthcare system. We've already, even if we were to think about the pilot perspective, I think COVID-19 was probably, wasn't that a pilot? I mean, it's, if you want to look at it that way, and governments did introduce point of care testing for COVID-19 in pharmacy. We've stepped up, we've shown our value, we were able to allow for fast, convenient, effective access to it. So why aren't we basing our conversation with the government on that? And why are we saying, okay, let's do another pilot?
It's a really good point. And I agree with you completely that we have already shown during COVID-19 that pharmacists are more than ready to provide these services. Our community pharmacies are equipped. We have the support staff. But it's one of those things where, as a pharmacist, I think our job is to show that we can do this stuff, and that's what we are trying to do. I agree with you completely. I don't think there is a need of pilot studies. The study that I'm talking about is funding models that's been offered by, I believe it's government of Nova Scotia, where pharmacists are incorporating the strep throat testing into the prescribing. So I think it's happening with the aim of expanding the prescribing services for the pharmacist, not just in a standalone POCT. But I think for a POCT, we don't need any pilot studies. We have proven enough during the COVID-19 that we are more than equipped, and it's time for us to offer this service for other disease conditions for our patients as well.
Thank you, sir. Luis?
Thank you, Sherif. Well, I think the pilots, they might be needed or might be used in different jurisdictions, but it depends on the context. For instance, you just take, for example, of course, the COVID vaccination, but even vaccinations in pharmacies. Of course, you can do a pilot, but FIP is actually providing data on this regard by collecting information, making a literature review, and getting the best practice worldwide. I think that in a way you can actually overcome the need of having a pilot, but of course that will depend on the jurisdiction. And from the policy point of view, from my experience, not only here in Portugal but also in other countries, sometimes governments do set a pilot, but they never actually become the real thing. So sometimes there is always this risk. So I would just like to share that maybe this information that has been collected, and to be honest, that's one of the major goals of FIP, is to actually collect the best practices and spread them throughout the world. Of course, that some countries can give more than others in a certain topic, but I'm sure on other topics that'll be the other way around. So I think that maybe that'll be able to be overcome. Well, regarding the need, and again, I'll use another practice change example just to showcase how can actually work on testing, on point of care testing. When you speak about, for instance, advocating for vaccination, we always speak about the untapped people that are not vaccinated, or the people, in a way, there's a lot of people, or there's an opportunity to improve people's lives. If we can are able to showcase that if we detect more patients with diabetics earlier in their disease pathway, that will reduce the costs. Maybe there will be the investment on that. If you just showcase that when you have a patient that has some chronic diseases and is being treated, if they have a regular point of care tests to assess if the medication is being effective, that will also have some economical effect. I think it has to do, and you might ask, or everyone can ask here, why that hasn't been done yet. I think probably because we are dealing with a lot of things at the same time. We see, for instance, on one hand, a lot of jurisdictions focusing on vaccination of minor ailment scheme, which is perfectly okay. But I think that we got to this point that probably there are so many opportunities that we just don't have probably enough resources to go to all of them at the same time. But that doesn't mean you can do it. And of course, that in some jurisdictions, people might say, well, we'll focus on COVID. vaccination, for instance, or testing or whatever, and others will say, well, let's start with point of care testing. Maybe it's easier because you have a good connection, you have more data. So it's very flexible. So I'd like to share with you this idea that pilots there might be needed, but there is already enough information just to move forward with some policy strategy. And on the other hand, just to choose our battles, because sometimes it's the best thing to do it if we can choose them, of course.
Thank you, Louis. Very interesting perspective, of course. And I think, to your point, this is one of the ways that FIP can help and provides value in being able to share best practice, and maybe again pilots in different jurisdictions can be used as examples for other jurisdictions and avoid the duplication of efforts. Ellen?
Yeah, and I totally agree with those points, and I think that pilots can be helpful to help encourage people to get into research. That's a really good angle for us to gain more data on what's happening well. But I think it does go back to Emma's previous point, which I think is an excellent one, where point of care testing is incorporated into services, then it is a tool. And I don't think as many pilot schemes and things are needed then, because it is a tool to help you get to where you need to get to with that wider service. I can see that a lot of investment has been done here in Wales, particularly in the infrastructure for community pharmacy, with all community pharmacies in Wales having a consultation room in order to undertake clinical services like point of care testing. But with the successful implementation of these services and the other common ailment services, prescribing services, pharmacies are now finding that they're needing more than one consultation room and more than one pharmacist working at the same time within a pharmacy. And financial remuneration is important, and ensuring services are costed appropriately to cover the pharmacist team, the pharmacy technicians and everyone that's involved in the work, as well as the expertise and the equipment. But as well as financial challenges, we do need to consider the current workload challenges that we have in community pharmacy, and we need to decrease the burden that dispensing volume is having, and freeing up more of the pharmacist's time for more of the clinical patient-facing activities. One of the things that we're really looking carefully at in Wales is the duration of treatment on regular prescriptions, and trying to move from 28-day prescriptions, for example, to 56-day prescriptions where appropriate, is one of the aspects that we're looking at to try and decrease that volume and ensure that we are considering the workload challenges that are in community pharmacy. Thank you.
Thank you, Ellen. Excellent point. Paul?
Thank you, Sherif. And look, at the risk of being at odds with my colleagues on the panel, I think there is value in running pilots, particularly as we transition from the early parts of scope of practice improvement, particularly when there is practice change involved in the delivery and the implementation of various new services. I think you are prone to more criticism from other stakeholders if you try and implement a service across the industry. And I've always found that, certainly in our experience in Australia, that running a pilot allows you to prove the concept. You can then evaluate it, and you can identify the health economic benefits of the service you're providing. And it makes it, apart from identifying the issues that may be roadblocks in terms of practice change involved in the implementation, it is particularly in the early days of transitioning away from purely a supply model in pharmacy. So I think there is benefit in trials, because if it's mass implementation, unless it is designed to succeed, you can run the risk of having a flawed program which destroys or damages your credibility, particularly with the policymakers. So I think our experience has been that a trial benefits the proper implementation of new programs across the board. And until such time as we have multiple programs working effectively in pharmacy, whether that be in prescribing or whether it be in primary healthcare programs, I think there is value in the proving the concept, looking at the practice change, and preparing our practitioners for all the changes that will be involved in delivering that service. Thank you.
Thank you, Paul. And I think this is also there is a follow-up to your comment, and also I think there is a follow-up from Christian on their question with regards to the remuneration piece, and they were mentioning that COVID-19 point of care testing should be considered as an exclusion as it impacted everyone, and that they were more speaking about chronic disease management and more specifically infectious diseases, which predominantly affects more marginalized communities. I think the point that where the COVID-19 piece came into play here is with regards to the concept, or the pilot, so to speak, has already been proven. If we were to look at the fact that what has COVID-19 point of care testing proven, that pharmacists have the necessary knowledge, skills, ability, accessibility, and capacity. Like those points have already been proven. So whether you talk about COVID-19 that affects everybody, or the point of care testing that affects a certain specific communities, those 5 principles have not really changed. They will apply on any point of care testing, whether it's for a large group or marginalized group. So that was just my point here, is that if we are all government patients, pharmacy professionals are on the same page as based on what we have seen through the pandemic, we do have those 5 key principles of we've proven we have the knowledge, skills, ability, capacity, and accessibility. So what else, that I think that maybe just to qualify my point, what else do we need to prove? So Emma?
Yes, so thank you. I very much corroborate what you are saying. And in Portugal, we have actually taken our experience in two large point of care testing initiatives. One for the COVID-19 testing, because we were testing at the national level, reimbursed by the government, so it was free of charge for patients. So what we did was we took the data from that experience, and we measured the impact of having included the pharmacy network in the testing strategy by measuring inequality indexes. So we've proven using the Gini index for inequalities that we reduced inequalities of access, particularly in for poorer patients, for aged patients, and specifically in less deprived areas in terms of and less populated areas in Portugal. And we measured the kilometers that people saved because of the involvement of pharmacies. We measured satisfaction indexes. We measured also, we asked people if they hadn't had the opportunity to do the test in a community pharmacy, what would be the alternative. So we had a lot of evidence coming from our involvement in the COVID-19 testing. And we also had another project where in a municipality, we participated together with a hospital, healthcare center, and NGOs in testing for HIV and hepatitis B and C. So, and what we found out was, and this was what was interesting from the results that we got, and we published those results, was that we complemented each other in terms of population that was covered. So, for instance, immigrants that were not registered in the national healthcare system in Portugal, they tended to use pharmacy more. They're a little bit afraid of going to the public hospital or the healthcare center because they're not registered, and also they sometimes they don't identify with the groups that are represented by the NGO, so they're not comfortable to go there either. So they're more comfortable in accessing these point of care tests in community pharmacies. So in Portugal, I would say that we don't need more pilot programs or pilot information, because I believe that drawing from the data from these two initiatives, what we were able to prove is that community pharmacies, due to their competence and proximity to the population, they contribute to reducing inequalities of access to these kind of tests. And on the other hand, even when other structures are involved in testing, community pharmacies can attract a certain demographic group that is not comfortable using the other structures. So we are able to complement the existing institutions that are already providing this kind of services. And I think that drawing from that evidence, we can extrapolate to other kind of tests and other kind of services. So I would say that once we get some data, even if it's based on a pilot project or a large scale implemented service, like for instance in Portugal, the case for COVID-19 testing, once you get that data, I think that you can use it to extrapolate to other areas. You don't need to make pilot projects for every single type of test and every single type of intervention.
Thank you, Emma. And I think it's what is clear here that we can make arguments on both sides, and I think ultimately it will be the determining factor is going to be the political will and how much we're able to advocate successfully with governments in our jurisdictions to navigate that point on the necessity of a pilot. And do they actually need a pilot, or is it just more of a tactic to keep delaying for other reasons? And sometimes this happens. So again, I think it's clear that the arguments here can be made both ways. Sarah, I think you want to weigh in.
Yeah, I just want to add a little point about the way I see the place for the pilot study is more based on how can we integrate the point of care testing into the community pharmacy practice seamlessly, and also if we can collect some data that tells us what kind of reimbursement model we would be looking to have a sustainable service. So I think those are the 2 points. We already have enough data or already have enough I think noise over there that pharmacists are more than capable. I think the pilot studies that I would really like to focus on should be how we can seamlessly integrate these services and for the better reimbursement model to have a sustainable service.
Thank you, Sarah. Excellent point. I see here a question from Jim. And I think this may be for the authors, and it's with regards to whether the national point of care testing and vaccination program in Brazil was observed in the study, and specifically how they overcame the regulatory and stakeholder pushback. So I'm not sure if either
Thank you, Sherif. I'm here.
yeah,
So,
well, thank you.
Thank you very much. So no, unfortunately, we didn't include Brazil because we just included the countries that respond to our survey, and we didn't have a response from Brazil. But please feel free to share this information with us, and we will pay attention to this important point of care testing services and also vaccination in Brazil. Thank you so much.
Thank you, Ines. So I think the next question I would like to pose, and also I want to remind you, if you have any other questions for the panelists, please do send them in the chat box. The question I'd like to ask you is, how do you think pharmacists can be more engaged and ready to participate in point of care testing? We've seen, obviously, again, what happened during the pandemic. It showed that we do have the, like I said earlier, the ability and knowledge and skills. How do we maintain that continued level of engagement, and how can we build on it?
If I may, Sherif, that's a 1 million
please,
question or the 1 million answer. That's why you're taking a while just to reply. So I'm in no way just preventing everyone just expecting for us to give you a magic formula for everything. Well, Anna has mentioned one very important point, the workload that we have right now in the teams, because fortunately we always perceive these new opportunities of new services of advanced practice as something good, and they are actually, but they have a toll on actually how do we accumulate that. And we have seen that during the testing, COVID testing. Of course, that we have very special conditions, but we know that the teams were actually very much pushed and forced just to sometimes just to work much more than sometimes is reasonable even from the mental health point of view. It's not by coincidence that we're now perceiving, not only in pharmacy teams, but also in other healthcare professionals, some mental health issues related to the stress and to the levels of anxiety that some of them had during the pandemics. But I think that we need to take that into consideration. But anyway, of course, that this might be a roadblock, but we will always find roadblocks, and we are here just to find enablers, something that can help us. I think it's important to have a different perspective of our practice, or to perceive our practice in a different way, because we tend to think, and this is a traditional way of practicing, that we have the dispensing part, we have some of the testing part, and Emma's also mentioned that we perceive them as separated. You actually see them as part of the same pathway that you need to have our patients go through it. So when you see the results that 50% of our chronic medicines are not effective because of lack of adherence, this is a good opportunity to increase adherence. I think it's important just to showcase and to promote the point of care testing as something as a add-on on our practice, and on a long run, or maybe on the middle run, just to perceive it as something standard. This is part of our deal. You should actually not say dispensing and testing, like dispensing includes testing, because in a way you need to actually evaluate if what you are dispensing is being effective. So I think it's much more, it has much more to do how we promote it, and that promotion of course has to come from different sources, may come from the national organizations, international organizations, from the leaderships also at the teams, which is very important to actually coach and to mentor the leaders of the teams, just to put that in the agenda. So I think this level of involvement might just help have more involvement, and just repeating the same verb, the same involvement from our colleagues.
Thank you, Luis. That's a very, very great insight into that. Mariette?
Thank you so much. And I would like to add on what Luis just said now with some perspective from South Africa. So some time ago, as all of you may or may not know, South Africa has quite a large burden of disease when it comes to HIV and AIDS. So some time ago, in response to our health minister asking how healthcare workers in South Africa could assist government better managing this specific disease, pharmacists came together with our South African Pharmacy Council, and we developed a program called Pharmacist Initiated Management of Antiretroviral Therapy. And in essence, it's, Louise, exactly what you said. It includes the testing part, but then as well as the initiation of those entry-level medicines or antiretroviral treatments for patients who maybe pass the pharmacy or get into the pharmacy, and then you can test them and you can initiate therapy. And although this sounds beautiful and worthy of a award, unfortunately, we did not get support from other healthcare professionals in South Africa. So the moment this was published for implementation, this led to a lot of media coverage of colleagues expressing their dissatisfaction with this. And at the end, it even led to a court case, which the applicant were not successful, but now there's the appeal process. So the sad part is actually, Sherif, and it comes to what you've said earlier, we have the capacity, we have the skill, we have the knowledge, yet there is another agenda preventing us at this moment to contribute to this massive burden of disease in South Africa when it comes to HIV and AIDS. So I think that's really sad in this day and age, maybe post-pandemic, where we all were able to take hands and move forward and support our citizens, getting through a pandemic, showing our expertise as healthcare workers, that then actually internally and among ourselves, we cannot agree that at the end it will be beneficial to the patient to have those HIV tests and to be initiated on therapy. And that really it's not about who is doing it better, because really none of us really own a specific disease or a specific test or a specific domain in healthcare. We are all here to work together, and the benefit, the patients still have the choice where they want to go to access their treatment and their benefit. And that's really sad that in South Africa for more than 2 years now, this amazing program has been put on hold. Thank you.
Thank you, Mariette. And obviously, you said the collaboration piece is key. And to your point, there will never be an empty bed in a hospital, and there will never be an empty chair in a doctor's office. So I think what we're trying to achieve, so when we talk about the point of care testing or other expanded services or expanded scope, is expanding the capacity of the healthcare system as a whole. Making sure that the right patient gets the right care at the right time, and also making sure that the person who is in that bed in the hospital is actually the person that needs to be there. The person sitting in the emergency room is the person that actually needs, to be there. So I think it takes a bit of an ongoing effort to educate and inform, and it is at the end of the day our responsibility to ensure that we do that. Give a quick example, and Sherif can certainly add more to that. In Canada, since the pandemic, we've shifted our Pharmacy Awareness Month in March to become Pharmacy Appreciation Month. So the point here is that we've shifted from the awareness piece. There is no more raising awareness. I think everybody, like if you don't know by now the value that pharmacy and pharmacists and pharmacy professionals then bring, then obviously something is not right. So I think the point is we need to build on that momentum. We need to continue to drive, and we don't want to look back at the pandemic time and think, yeah, this was a good time where pharmacists were heroes. No, we need to take it as a launching pad, for how do we continue to build that. It is our responsibility to continue to remind policymakers of that. People have a short-term memory. They can now start from investing in pharmacies at times, and now looking at even making cuts into pharmacies when we're actually talking now about how do we get them to reimburse for point-of-care testing. They may already be thinking, about how do we make up some of the costs and expenses that we've had during the pandemic by cutting in different sectors. So it is our responsibility to continue to drive that point and make sure that they don't forget. Ellen?
Thank you. And I think we know from a lot of the research that we've done with our members here in the UK that, when people get to use their clinical skills more, they get a lot more enjoyment out of their work. But one of the key things that we're advocating for the Royal Pharmaceutical Society is for pharmacists, pharmacy technicians, and wider members of the team to have access to protected learning time, because it is a lot to ask of our practitioners to do on top of the day job to continue with their education and training. Although it's an important part of what we do, it would be great to have some time at least incorporated into our daily work to cover some of the time that we dedicate to expanding our scope of practice and knowledge. Also recognition for the work and the advancements within the profession. And I think we can't underestimate the value of peer support, learning from others that are already advancing in the work that they're doing around point of care testing. Having time to go and spend some quality time in practice with those people, sharing from what's happening. And that's why I think the work that FIP has done with this report is so valuable, because we're not just sharing on a local level, we're sharing on a global level. And we look forward to continuing to share the advancements that we get from our country with colleagues globally.
Thank you, Alan. Sarah? I think let's ask the question.
I know we don't have a lot of time left. I will be very quick. I just want to add on what my colleagues are saying over here. It's time for pharmacists to be away from that, like Sherif said, like, people are aware what we are doing. I think it's time for us to actually just start owning those services, start owning those clinical activities that we are so much involved in. In Alberta, pharmacists have been prescribing as independent prescriber for many years, right? But because there is a clear guidelines over there, there is a regulatory framework. So I think for us to have pharmacists more engaged in point of care testing at community pharmacies, we need to build on those. So having a very clear guided regulatory framework. We also need to make sure that we have the ability to design our workflows in the community pharmacies that can accommodate those point of care testing and integrate them into other clinical activities that we are providing on daily basis. I just want to add a last point about the technology integration. So I think that's really important, because things are moving toward AI and all the new technological innovations that we are seeing. So having a point of care testing, and maybe there would be a day come where that test result can be uploaded on a cloud-based or a web-based portal, which will be accessible not just by the pharmacist, but maybe by the primary care physician, as well as the other people involved in the circle of care, and will provide patients a very comprehensive care model. And thank you, FIP, for this great session and inviting me to share thoughts from Canada.
Thank you, Sarah. We have one more question that is here in the chat, and it's from Miroslava from Slovakia. And the question is, do countries apply guidelines in point of care testing? I think this is more from, I guess, from a regulatory perspective. They say that in Slovakia, we adopted the guidelines from November 2022, so just about a year. And until then, we could perform point of care testing in community pharmacies, but we did not have a uniform procedure. Emma, I see you have your hand raised.
Yes, maybe I can tell what we have done in Portugal. Yes, we do have guidelines, and we provide from the National Association of Pharmacies, we do provide support by the way of protocols and flow charts for pharmacists to be able to follow. But the most important thing is that we follow the same guidelines as the other healthcare professionals in each country. So it's very important that we are aligned with the way that other healthcare professionals and other healthcare institutions are operating. So we usually always refer to the National Healthcare Service guidelines if they're available, and then we adapt them to the day-to-day practice in community pharmacy. So just as a suggestion, is that we always try to align with the other healthcare professionals and institutional guidelines, and favor the existence of a national guideline that applies to all healthcare professionals the same. And I would also like to take this opportunity to thank you all for a very interesting session, and congratulate FIP on this great body of work.
Thank you, Emma. So I see that we are just almost at the end of our event. So I would like to ask each of the panelists, if you wish, to provide a final take-home message for pharmacists regarding point-of-care testing.
Well, I may, if you don't mind.
Emma, please go ahead.
Yeah, the final take-home message is just do it, even if it's not yet reimbursed by the national healthcare system or insurance. Patients are willing to pay out of pocket. That's the experience in Portugal. They like the fact that they get the result immediately, that the pharmacist has time to counsel on the result and has the competence to do it. So just do it. And of course, that education about it is important. And hopefully this FIP report also helps national organizations and even individual pharmacists to understand where they can get additional education and training to provide these kind of tests. We have a lot of international experience, so we can definitely go and benchmark with other countries what they have done and how we can successfully implement a service that has point-of-care testing as a component or as a standalone service. So yeah, this is the time to advance and to think about how we can facilitate the adoption and overcome the barriers.
Thank you, Emma. Luis?
If I may, probably I'll echo some of the parts that Emma has shared, but I think that this report, this event is a starting point, not an end point, definitely. So try to make the most of all the information, trying to learn with our colleagues. Looks like there's a lot of people that are interested in this area. That's why we have so many participants, and I'm sure some of them were not able to participate. So just move forward with what you think is relevant. And probably I didn't emphasize that beforehand, but although we are speaking very much on policy and about on the big picture, I think it's up to each pharmacist in their own practice to make a difference. So it's a good time to start doing that. Thank you.
Thank you, Luis. Mariette?
Thank you. Again, adding on to the previous two speakers and the advice that they gave is, if you find maybe the reports overwhelming because there's this long list of point-of-care testing and you just maybe one pharmacist, you don't know where to start, access your barometer reports in your country or your incident reports in your country and find out what is the most prevalent disease in your community or in your area, and start maybe with those point-of-care testings. And remember that those that we did many years ago might still be relevant, but as life goes on, I mean, 3-4 years ago, we never heard about COVID-19. Now that's one of the most frequent used words in the world. So it's evolving as disease patterns change, but that's maybe a good point to start and start making an impact there and then where you are in your community. Thank you.
Thank you, Mariette. Sadaf?
Just want to say that point-of-care testing it represents like a very transformative opportunity for pharmacists to actively contribute to patient care. And we all know there are hurdles. We all know that there are those roadblocks, whether it's reimbursement process, whether it's the workflow, whether it's the regulatory framework. But I think by incorporating such a service for your patients, you have the potential to not only enhance the healthcare accessibility, you're also improving patient outcomes, and you're playing a very integral role in evolving the landscape of primary care for your for your patients. So go for it. There will be those roadblocks, but I think with the help of events like that, with the help of the global point of view, I think we can help each other.
Thank you, Sarah. Ellen?
A lot of agreement from me here. I think prioritize what your patients need, get involved and continue sharing your great practice. And I feel really energized by hearing what's going on in other countries today. Thank you, everyone.
Thank you, Ellen. And we'll give the last words to our president, Mr. Paul Sinclair.
Thank you, Sherif. Very quickly, I agree with all those sentiments. I would encourage pharmacists to embrace this opportunity and to use it as a tool to improve patient outcomes within your pharmacies. You need you might start with one particular disease state, implement point of care testing, gauge for yourself how the impact that you can make. But it's definitely a tool that we should be using. There are only upsides from it in outcomes for our patients and the services we provide to them. So I would encourage you all to have a good look at the report. Congratulations again to everyone involved, and we welcome. Hopefully, this will be a strong advocacy tool for a number of our member organisations as well. Thank you, Sherif.
Thank you, Paul. With that, we come to the end of our webinar today. I would like to remind you that the recording of this session will be made available on FIP.org. I would also like to thank all our speakers and FIP staff for a fantastic and informative presentation. And certainly would like to thank everyone who has tuned in for the webinar today. We hope that you enjoyed the talk and the discussion. Please also remember to provide your feedback to webinars@fip.org so that we can continue to improve the digital event offerings. And very important, would like to remind you, of course, to if you can, attend and join us at the 82nd FIP World Congress Pharmacy and Pharmaceutical Science that will be in Cape Town in 2024. It will be great to see everybody and connect in person over there. So with that, again, I'd like to thank everybody and have a great rest of your day.
Thanks, Sherif.
Thank you so much.
Thank you.
All the best.
Thank you.
All the
Thanks,
best, everyone. Bye-bye.